My capstone is an exploration of if healthcare workers had access to acupuncture, and I surveyed acupuncturists to see if they were treating healthcare workers. First off, I would love to thank my advisors for walking me through every step of the process. I really appreciate going back and forth about data and all their guidance on how to make this capstone happen. I also really appreciate my family and all their support, for emotional support and childcare, navigating that. I'd also like to thank the survey respondents who took time to answer my questions. So thank you very much. Be going through the introduction, the methods, the results, and the discussion of my capstone. First, I'll invite you to think about how much we care for our patients, and the educators in the room too. You're called on to be healthcare providers in some ways, but how much of our hearts we give to our patients. Sometimes we hear heart-wrenching stories and it makes our hearts flutter, loss of sleep for a night or two, but we're very blessed to have like Dr. Sodders and a place to discuss how to stay healthy while we provide for our patients. And we have acupuncture as a resource for self-care. Some of our other colleagues aren't as blessed. Physician burnout has reached new distressing levels. Nearly 2/3 of doctors are experiencing at least one symptom of burnout. And a scientific literature search on PubMed will list lots of articles, so many that the mainstream media, this is a New York Times article, has picked up on this epidemic of a problem. This article is from 2022. There's even an ICD-10 code for burnout. And some of those are insomnia, anxiety, secondary traumatic stress, PTSD, and a feeling of no longer connected to their patients and no longer feeling comfortable in their careers or inspired. But acupuncture can help. Many of us know that acupuncture really reduces not only our own stress, but that secondary traumatic stress. It can help feelings of burnout and depression. There's a scientific study done on acupuncture for healthcare workers where they reported the amount of stress before a series of acupuncture treatments and after, and there was a significant stress reduction. And the healthcare providers, it was done at the VA, were able to better care for their patients after the series of acupuncture treatments. And another study in a hospital in Boston also provided acupuncture for their healthcare providers, and the healthcare providers reported a heightened capacity for caring after the series of treatments. One of the ways acupuncture works from a biomedicine standpoint is it gets us out of our fight or flight. We're in that sympathetic nervous system where heart rate's racing, a little bit of shortness of breath, kind of like when you're giving a presentation. And acupuncture gets us into that parasympathetic nervous system, the rest and digest. And that's when our body can heal. From a classical Chinese medicine standpoint, excessive qi can create blockages in our heart channel. Our heart channel goes through our arms, and we give to our patients, we're kind of giving from the heart. We're needling, reaching out from our heart channel. And when there's blocks collected in the heart channel, can decrease that patient-provider relationship. We also have that connection to spirit in our Shen. And the classical Chinese medicine outlines ways to have our Shen rooted in the heart, rooted in spirit, so we can make that connection with our patient. So we kind of established that acupuncture can help from a Western standpoint and a classical Chinese medicine standpoint, but can acupuncturists help? Do we have the infrastructure in place to treat healthcare workers? During my master's program, we had an externship at UCSF, Benioff Children's Hospital. That was part of a Care for the Caregiver program. We treated the staff on site in the spiritual care room and community style acupuncture. We had about 10 chairs, and doctors, nurses, office admin, cafeteria workers would come on their break. Some of them would be like, I have 15 minutes. I'm really stressed out. What can you do? And we would retain needles for 5 to 10 minutes and they would leave feeling better. Overall, they reported better patient care after the acupuncture treatments. We did collect some data where we treated 54% of the patients that we treated there were nurses, only 7% were doctors, and 54% had never had acupuncture before. So it was a way to introduce acupuncture to this Western medical staff, and they loved it so much that they became advocates of acupuncture. So much so that they started referring their patients out to other acupuncturists and advocated for the hospital to hire their first in-house acupuncturist, and not at an integrative medicine clinic across the street, but in-house as hospital staff. So I wanted to take a look at, are acupuncturists treating healthcare workers? And if so, is it in kind of a workplace wellness care for the caregiver type program, or in their regular private practice? How many healthcare workers are they treating, which professions, and some demographics about the acupuncturists. I first started doing a literature search for existing workplace wellness programs. A workplace wellness program is where an employer will provide different healthcare services, either on campus or other resources. And I did find that 29% of hospitals had on-site workplace wellness programs versus 13% of other types of employers. However, many of these programs were more about weight management, maybe diabetes education, how to stop smoking. Some of them did have like Zoom yoga. With the heightened levels of burnout during the COVID-19 crisis, hospitals kind of tried to ramp up some of these workplace wellness programs. But what I found was that American Hospital Association published what hospitals were doing. One of them was casserole at cost to their employee. They weren't even free. The hospital employees had to pay for casseroles. And that was kind of their like, hey, you're burned out, buy a casserole at cost from us. It's a sweet gesture, but it's not medical care. Another hospital reported doing a lavender cart, and you can call code lavender. And at first I thought it might be relaxing essential oils or something, but it was a lavender colored cart filled with junk food snacks and a pamphlet or two about some mental health support. That kind of goes against their diabetes education and nutrition education of the other programs that they have. One study showed that even the hospitals that did provide some mental health support, a lot of it went unused. 50% of physicians did not know that their hospital had it or had a hard time accessing the mental health support. When I searched for acupuncture for COVID-19 workers, both on Google and in PubMed, only one study came up, and it was in Brazil where they did auricular acupuncture. And after a series of acupuncture treatments, they had a significant improvement in mental health. As far as existing data on the acupuncture profession itself, the California Acupuncture Board and NCCAOM, which is the national certification body, does publish some demographic information about our profession. There's not very many scientific journal articles about our profession. There is a couple in 2012, but the most current would be the CAB and NCCAOM's data. One of the things that I found when looking for articles is acupuncture is combined with complementary and alternative medicine. So I wanted to do a study that was just acupuncture, and same with acupuncture utilization data. I found one study where healthcare workers were more likely to use acupuncture than the general public. My hypothesis was that acupuncturists are treating healthcare workers, but in their regular practice and not in a workplace wellness program. So I created a survey to ask acupuncturists if they were treating healthcare workers, and if it wasn't a workplace wellness program or their regular practice. Which healthcare professions were they treating? What type of payment did they receive? How much? Did they do any targeted marketing? And some demographic questions. I created this on SurveyMonkey. It was 19 questions, approximately 7 minutes. And there's various question formats. This is one example of a question with the drop-down menus, and I had some open-ended questions, and Dr. Grieve and I went back and forth with how to put this together. If I were to do it differently, I might have made it each question simpler. I kind of did some compound questions. Because this is a survey on dealing with human subjects, although not an experiment on them, I did have to do the internal review board training and approval process. So I had to fill out an application and get the internal review board to approve the project. I distributed the survey on social media, mostly in Facebook groups for acupuncture students and licensed acupuncturists. These Facebook groups had members from around the world. It also went out on several acupuncture school emails for current students and alumni. And then I analyzed the data using Excel, SAS on demand for academics, and I mainly did descriptive statistics of means, standard deviations, and counts. I included adults and anyone legal to practice acupuncture. This included students working under supervision. It included licensed acupuncturists, or whatever jurisdiction would call the equivalent. MDs, dentists, podiatrists, other professions are legally allowed to practice acupuncture, and they were welcome to take this survey. Overall, I had 179% respondents and 70% response rate. So about 70% of the people completed the questions. They were able to stop anytime. There was no incentive for completing it and no penalty for completing the survey. So the results in the graphs ahead are based on the known data. These are my results. Don't worry, this is about 1/10 of the Excel document that I analyzed. And thank you to Dr. Mark Sodders for going through this and cleaning the data and analyzing it. This is a little easier to read. Overall, we had about 45% of the respondents were white, a little over 10% were Asian, about 5% were Latina, and like 3% were African American. The average age was 46 years with a standard deviation of 9 years. The education, they actually had 1% of respondents as bachelor's degrees, and I think this is because it went out on Facebook groups from around the world, in different jurisdictions, including the UK and Canada, allow bachelor's degrees to practice acupuncture. So I may have had a couple of respondents from there, although no identifying data was collected. In the US, the majority of the states require a master's degree. And we had 41% had a master's degree, and only 26 had a doctorate degree. And I'd be curious to do this again and see if that continues to rise as programs like this continue and we have more graduates. Overall, 94% of respondents were treating healthcare workers. It's 94% had treated some sort of Western healthcare provider. 5% did not know, or 5% did not, and about 1% did not know whether or not they had treated healthcare workers. So only 2% at the time of the survey, which was November of 2022, were currently in a workplace wellness type program at a hospital. So we're treating healthcare providers, but only 2% reported being in a workplace wellness type program. Whereas prior to the past year, about 13% reported being a part of a workplace wellness program like that UCSF one. That one is no longer in surveys. It was a relationship between the hospital and the school. But I wonder if other programs were shut down because of COVID or other reasons are limiting the in-person contact, although we can provide acupuncture safely with masks and clean needle technique. Overall, 46% reported being in a solo type practice, and only 3% were reported being employed by a hospital. And this data is consistent with the California Acupuncture Board and NCCAOM's data on this. They actually had about 1.5% of their respondents being employed by a hospital, and the majority of respondents being in some sort of solo practice. A little over 10% were in a multidisciplinary practice, maybe with chiropractors, MDs, other providers. Just under that was the TCM group, and then community style acupuncture next, some other arrangement. It's a little less than that. And then acupuncture school employer was just above hospitals. 14 minutes left. We wanted to look at approximately how many healthcare providers they were treating. And most of the people replied just kind of under 10, a handful. We had 24%, just 1 to 4 healthcare providers in their regular practice. 31% is 5 to 9, and only 11% were treating over 50 healthcare providers in their private practice. So even though 94% of us reported treating healthcare workers, we're still not treating very many. And this is the workplace wellness program data. And here only 11 people replied that they were in a workplace wellness type program. So it's a very small sample, but just under half reported only seeing 1 to 4 people within that workplace wellness program. And 9% were seeing over 50. So it seems like even the workplace wellness programs are small. And this is those two charts put together, and you can see the trend is relatively the same. What type of healthcare professions are we treating? 67% of acupuncturists reported treating nurses, 42% mental health professionals, 42% other licensed acupuncturists. Like to see that a little higher is boosting our own self-care and getting regular acupuncture treatment. And only 33% are treating doctors. And I would be curious to know as to why. Anecdotally, I had a doctor in my practice who just didn't feel confident scheduling an appointment for herself because she was on call and her schedule was really crazy. She didn't know if she could come and relax for an hour. With the growing scientific body of evidence that we have, I hope that more and more MDs are believing in acupuncture. I looked at some studies that show that there was like 58% of MDs in New Zealand think that acupuncture is the most effective complementary and alternative medicine modality. And also another study showed that direct experience of the medicine or of a complementary and alternative medicine modality helps inform their knowledge of it. And one thing about MDs being one of the lower ones of 33% is that insurance companies and patients definitely refer to their opinions and referrals for coming to see acupuncturists. "39% of the healthcare work or of the acupuncturists reported that the healthcare workers were paying out of pocket, and only 25% were using insurance benefits to pay for their treatments. And this could be because the acupuncturist did not accept insurance, or it could be because their insurance plan doesn't cover acupuncture. In California, acupuncture is an essential healthcare benefit, and insurance plans are required to cover acupuncture, but that's not the case around the country. And a lot of acupuncturists don't want to deal with the rabbit hole that is insurance billing and do not accept it. 10 minutes. But the average self-pay amount was $87.41 per treatment. And the standard deviation was $35.50. I think part of that is because some people reported the community acupuncture style with a sliding scale of $20 to $40 per treatment. 3% of acupuncturists volunteered for the healthcare providers. 2% didn't know how the patients paid, but 0% were paid by that workplace wellness program. So even the 2% that were part of the workplace wellness program, none reported being paid. Acupuncture and Western medicine can have different languages. And one of the things that I was nervous about, and my colleagues were nervous about doing the UCSF project, was, can we talk to Western providers about this medicine? Only 39% of respondents reported being completely confident speaking to Western providers about acupuncture. Thankfully, no one replied that they were not at all confident. And 22% were about moderately confident. I think that's a continued discussion we have in these classes as well, as how do we translate this to Western providers? Only 8% did targeted marketing to healthcare workers. Remember that 94% reported treating healthcare workers, but only 8% did targeted marketing. So how are they finding out about acupuncture? Probably the growing body of scientific literature showing how effective it is, word of mouth from colleagues, and direct experience and referrals from people they trust and other Western healthcare providers. And I did find some studies that are in my paper that show that. 34% of acupuncturists reported having a specialty. And then there was an open-ended question of what it was. And we had several: women's health and fertility, there's pain management, trauma, sports, or all the specialties listed, or some combination of those. 17% had an additional license to acupuncture. You had 7% had a massage therapy license, and 2% also had their registered nurse licensed. We had a couple naturopathic doctors. I did not see any MDs that answered the survey. There are MDs that can do some training in medical acupuncture and practice under their MD license. It would be interesting to ask them if they're seeing any healthcare workers. 7 minutes. So overall, 94% of acupuncturists treated healthcare workers, but only 2% were in a workplace wellness program, and none were paid. We saw mostly nurses that were paying out of pocket, and there were acupuncture treatments were done by solo practitioners and not hospital employees. So 94% of us are treating kind of a handful of acupuncturists, but only 2% in the workplace wellness program, and none were paid. So the workplace wellness literature that I found in the PubMed searches and looking online at the American Hospital Association publications, the CDC, I only found a handful of workplace wellness programs that had acupuncture in them. And this was consistent with the findings of this survey, where only a handful of acupuncturists reported being a part of a workplace wellness program. This UCSF program, where think 54% of the patients were nurses, was kind of consistent with the acupuncturist reporting, seeing the majority of nurses. The acupuncturists in this survey did report treating more MDs than at the UCSF program, because that was about 6% MDs that came to that program. The occupational analysis from the California Acupuncture Board and the NCC AOM had consistent data with the solo practitioners being the most common type of practice that an acupuncturist is in, and hospital employees the least. And it is a different debate of whether we should be integrated into the Western medical model. There's definitely plus and minuses to that, but I'm a big proponent of getting acupuncture out to as many people as possible, because it is such a wonderful and effective medicine. And if it makes it more accessible to be part of the Western healthcare system, getting insurance reimbursement rates higher, more insurance plans covering acupuncture, I think that's a really positive thing. The limitations of this study was that it was in English. It would be interesting to also publish it in Chinese, Korean, and Japanese, and see if the numbers change. It was also distributed amongst licensed acupuncturists. I did not have, I didn't find access to like a medical acupuncture Facebook group or other newsletters that go out to MDs that have medical acupuncture as part of their practice. I'd be curious to look at if Western providers will go to a colleague that does acupuncture that has a RN or a medical doctor license. And that could be part of the future research. We can also take the data that I did, and you saw that giant spreadsheet, and analyze it in so many different ways. We can do some linear regression. The acupuncturists that have the doctorate degrees seeing more of different healthcare providers than the ones with just the masters or the bachelors. Is their level of trust that MDs have with doctors. So we can use the same data set to analyze it in different ways. We could also repeat the survey in a couple of years to see if the data has changed. And I would love to see more pilot programs done and expanded on repeating that UCSF care for the caregiver program of having acupuncture on site in hospitals, and see if that can be replicated in other hospitals around the country. And if we're able to do that and treat more healthcare providers, the healthcare workers will receive the health benefits. They might feel lower rates of insomnia, depression, those feelings of burnouts, being able to have that connection with their patients. It also, acupuncturists need job stability, whether it's a private practice or an employment situation at a hospital. We do need to get paid for our services, whether that's insurance benefits or self-pay, but it would be great to increase the access through insurance. And that will ultimately expand patient access to this medicine that we love. Yeah, so I have my references. And any questions?
Excellent. I'm going to just check in. Dr. Griever, Dr. Saunders, can you give me a thumbs up